are hospital systems getting more patients than your practice? The hidden communication gap that may be costing your practice patient retention, referrals, and growth. If you're a physician owner or practice administrator, you've probably asked yourself a frustrating question. Why are hospital systems and large healthcare organizations attracting more patients when we provide excellent care? The answer may surprise you. It's not because they have better physicians. It's not because they have better outcomes. And it's not always because they have a larger advertising budget. Often, they are simply communicating more consistently. While independent medical practices only communicate when a patient schedules an appointment, receives a bill, or needs paperwork completed, larger organizations stay visible year-round. They send educational emails, they share updates, they provide health information, they stay connected. As a result, they remain top of mind. And when patients need care, they often choose the provider they remember. The real problem isn't your medical care. Most physician-owned practices deliver exceptional care. The challenge is that patients only experience that care when they walk through the doors. Between visits, life gets busy. Patients become distracted. Referral relationships grow quiet. Competitors continue communicating. Over time, patients who once knew your practice very well may slowly lose a connection with it. Not because they're unhappy, not because they had a poor experience, but because they stopped hearing from you. That communication gap can quietly affect patient retention, patient referrals, professional referrals, practice visibility, long-term practice growth. Why this matters more than ever. Healthcare has become increasingly competitive. Hospital systems, private equity-backed groups, and large healthcare organizations invest heavily in staying visible. Meanwhile, many independent practices continue relying primarily on word-of-mouth referrals. Word of mouth is powerful, but it works best when it's reinforced by consistent communication. Patients who hear from your practice regularly are more likely to remember your name, recommend you to friends, and return when they need care. The practices winning today are often not the loudest, they are the most consistently visible. The good news, you don't need a big budget. You do not need a hospital-sized marketing department. You do not need expensive advertising campaigns. You do not need to send emails every week. You simply need a system that keeps your practice connected to patients and referral sources throughout the entire year. One of the most effective ways to do that is through a patient newsletter. A newsletter is not just an email. A newsletter is a relationship-building system. We offer a 3-step newsletter plan for medical practices. Step 1, create a 12-month content calendar. The biggest practice mistake we see is waiting until the last minute to decide what to communicate. Instead, create a simple annual content plan. Topics might include seasonal health reminders, preventative care tips, frequently asked questions, physician updates, staff spotlights, community involvement, new services and technology, patient education. Planning ahead eliminates stress and creates consistency. Step 2, use one topic across multiple channels. One newsletter topic can become a blog article, a physician video, social media content, website FAQs, patient handouts. This approach creates reinforcement rather than random acts of marketing. Patients rarely take action because they see one message one time. They take action because they consistently see the same trusted practice showing up with helpful information over time. Step 3, before you sell, the best newsletters do not feel like advertisements. They feel helpful. Patients want educational guidance, reassurance, health tips, practice updates. When your newsletter focuses on serving rather than selling, patients begin to look forward to hearing from you. Trust grows, relationships strengthen, and your practice stays top of mind. You might ask, what happens if we do nothing? If communication remains inconsistent, patients may forget about your practice in between visits. Referral sources may think of another provider first. Competitors may appear more visible and more active. And larger healthcare organizations will continue strengthening their brand and relationships with the very patients you serve. The risk is not losing patients overnight. The risk is becoming less memorable over time. What happens when you communicate consistently? Patients remember your name. Referral partners remember your expertise. Your practice remains familiar. Your visibility increases. Your reputation strengthens. And familiarity becomes trust. That trust influences future appointments, patient referrals, and professional referrals too. Small, consistent communication often outperforms large, sporadic marketing efforts. A monthly newsletter may not feel dramatic, but over time, it compounds and builds. The next step, if your practice does not currently have a newsletter strategy, now is the time to start. Start simple. Start with one email each month. Start with the goal of helping your patients and referral partners stay informed, because the practice that communicates consistently is the practice that continues to grow. And in today's healthcare environment, staying connected may be one of the simplest ways to protect your patient relationships, strengthen those referrals, and support long-term practice growth. Are you ready to build a newsletter strategy that keeps your practice top of mind? Schedule a GrassRoots medical marketing audit call, and let's create a communication plan that ensures your practice stays visible, trusted, and remembered. This 10-minute task could mean more than 10 phone calls this month. Now that's what I call great return on investment.